Thank you. James Davis.
Thank you, Chair. I'd like to turn to diagnosis rates of dementia, if I may. So going back to the 2015 Prime Minister's Challenge for Dementia, there was an intention to ensure that 2/3 of the predicted prevalence of dementia should receive a formal diagnosis. There was success on that front. Over the pandemic, we've dropped back a bit, I think to 61% or so. What are the intentions to try and recover the situation?
So early diagnosis is crucial. It's crucial to make sure that the individual gets the support that they need, and actually, really importantly, that those caring for them can access support as well. As you say, we've done really well through the Dementia Challenge period of hitting the target of making sure that 2/3 of those who are estimated to have dementia in the country have a diagnosis. During the pandemic, that slipped backwards. For understandable reasons, it's harder to access services, but we want to get that right back up above the target. NHS England is spending £17 million to bring that back up, to take steps to increase the diagnosis rate again. And we have seen improvements in that rate in the last couple of months. It's not back up to the target yet, but it is going in the right direction.
Obviously, the reopening of face-to-face consultations will help, but what are the kinds of measures specifically that will be put in place just to ensure there's a focus on this area?
So NHS England has been working and communicating with GPs about getting back on track with this target, about access to memory assessment services, supporting access to them virtually where that is appropriate, and I recognise that that's not always appropriate. So those are some of the sorts of things that are going on to address that target. I'm wondering whether this might be a good moment to bring in Tom Surrey in case you can give any further detail, if the Chair would be happy to do that. And
of course,
if I
yes.
haven't put you on the spot.
Thank you, Minister. Well, no, not at all unhelpfully. I don't have a huge amount to add, but there has been a series of contacts between NHS and GP networks to make sure that they're aware of not just the reopening of memory clinics and the Dementia Well pathway that is in place, but also to build on some of the innovation that happened during the pandemic period and the increased use of remote memory clinics and remote assessment, and pass that on through. We've also been working, and NHS colleagues in their personalised care team have been working quite closely with some of those who gave evidence at your previous session, in particular the Alzheimer's Society, to launch a new website to provide information about the memory assessment process and make sure that both professionals and those carers have access to the information they need to provide those services going forward.
When diagnosis does occur, there's then often a bit of a gap in provision, so post-diagnostic support. What work's taking place to improve that situation?
So again, critical next step after diagnosis is to make sure that people have the information about what support is available, and for instance access to a link worker who can help them navigate the system, which I know can be daunting for somebody who encounters needs to use social care services for the first time, and also you're coping with the implications and the consequences of somebody you love, for instance, having a dementia diagnosis. So I think making sure that there is good information about the support services is a really important part of the picture. But I say, to me, the first step as we come through the pandemic on this is to just get the diagnosis rates up again, so that we know we are identifying people early on. Important both for their support, but actually, in fact, there's a connection with research here, and where we know that we can have better information for research if we have earlier diagnosis.
Thank you very much.